Hello everyone. We are going to see today the clinical use of the Surgiplaster G170. As you can see, the code color is red, so it's actually really recognizable also when you stock the boxes. We're gonna open this. This is the instruction pamphlet. This is the tags that you can use. One is actually to give to the patient and the other one is for the patient's chart. Then we have the box. Plastic around it. Remember, everything is sterile in here, so be careful how you touch it. And this is the sterile part, so you can actually place it on the surgical table. You open it up. We have in the inside the 2 sterile dappens. Then we have the regular mixing liquid, which is physiologic solution, and we have the fast, that it's a solution based on potassium ions that we use in order to speed the process of hardening of the biomaterial. And here also we have the mixing tools. Remember, these are sterile, and this is how it is. This other vial is very important. This is the powder. This is calcium sulfate anhydride, and it's in the form of powder. We use this to as a membrane on top of the implants, and also we can use it in apicoectomies in the bone crypts to actually control the bleeding and use the filling material in the canals. Then there's the G170. You can actually see the granules, and remember, the granules are 0.5 to 1 millimeter diameter, and we can use this in molar region for bigger lesions like medium cysts, and also we can use it for the crestal or lateral mini sinus lift. Okay, remember that this is, you can also sterilize this, also the cap. Remember not to touch anything. You can pour inside the amount that you need. Remember that you can add it up. If it's too much or too little, you can either use it or not. This is the regular. Remember, with the pipe, with the little liquid thing, we have to go drop by drop because we want it to have a good consistency. Remember, when you mix it, to incorporate all the granules. Like this, take your time. And then this is the kind of consistency that you want to have. You can actually see the different size of the granules. And remember that also you can fold this dappen and you can actually slide the biomaterial inside of the defect so you don't lose anything. Okay, so this is the little vial with the powder, and we can use it as a membrane on top of the defects to seal the granules inside, especially if we don't want to use membranes or we don't want to use collagen on top of the defect. We use the fast, and I told you it's like potassium ions that help the hardening process to speed up. That's why it's called fast. Here, when we mix it, of course, we have to be careful with how much liquid we want to place because we don't want it very liquid. Again, we want it like in form of a little kind of cement, and we want it to adapt. So also here we have the liquid, and we have to incorporate all of the powder over here. Very easy. You can do it with this one, you can do it with another spatula, but this is mono use, so it's really, really easy. And this is the kind of consistency that you want to reach. You can again spin it around, it doesn't move, it sticks to it, and you can bring it around or actually pour it as I showed you before.